Have you ever thought about what it takes to get a simple medicine into your hands, or even just to have clean water come out of your tap? Behind these things we take for granted, there's this vast, invisible system that's working 24/7. So today, we're going to pull back the curtain on that hidden world, the invisible iceberg that for the most part keeps us all healthy.
And that quote right there from Professor Haydar Sir, well, it's the perfect metaphor for what we're talking about, a health iceberg. You know, what we actually see, the hospitals, the doctors, that's just the tip. But the real story, the real power, and honestly, the real vulnerability is in that massive part that's hidden underwater. That's what we're going to explore.
All right, so here's our game plan. We're going to start big, looking at this massive and kind of fragile system. Then, believe it or not, we're going to zoom all the way down to a microscopic battle happening inside your own mouth. And here's where it gets really interesting. We're going to see how these two worlds, which seem totally unrelated, are actually connected in a really critical way.
So what is this huge, unseen part of the iceberg? Well, it's basically the public health supply chain. I'm talking about a mind-bogglingly complex global network that gets everything, from life-saving vaccines to a simple bottle of aspirin, all the way from a factory to your local pharmacy.
But here's the thing. This super important system is shockingly fragile. The COVID-19 pandemic was this brutal global stress test, and the system pretty much failed. I mean, you remember the scramble, right? The wealthiest countries on the planet couldn't get their hands on basic stuff like masks or ventilators. That was a massive wake-up call for everyone.
So you gotta ask, right? Why is this foundation so weak? It turns out a huge part of the answer comes down to just staggering inefficiency and waste.
Let's just try to put a number on this. In just one country, Turkey, the value of medicine that gets thrown out or expires every single year is $5 billion. That is not just some number on a spreadsheet. That's a colossal failure of the system.
This quote just nails it. It's like spending a year building a huge brand new bridge and then immediately tearing it down. And it's not just the money we're losing. Think about the environmental cost of making and then getting rid of all that medical waste. It's enormous.
So what's the root cause of all this fragility and waste? Well, at its core, we're trying to solve 21st century problems with a 19th century way of thinking. Our systems for buying things are stuck in the past, totally obsessed with one thing, finding the lowest possible price up front, while completely ignoring long-term value.
Okay, to really get how we can fix this massive system, we're going to do something that might feel a little strange. We're going to zoom in. I mean, way in. We're shifting from the global supply chain down to the microscopic ecosystem inside our own mouths. And this is where this big, abstract problem gets really personal.
We've all heard of dental plaque, right? But what if I told you it's not just some gross film on your teeth? It's actually a living, highly organized bacterial city, a bustling metropolis that's home to over 700 different species of bacteria. It is a crazy complex ecosystem right there in your mouth.
And what's really wild is that this bacterial city is unique to you. Your oral microbiome is like a fingerprint. It's the reason some of us are always battling cavities while other people are more likely to have issues with gum disease. There's a totally personalized battle happening in there 24/7.
So, how in the world do you fight a complex bacterial city? You know, a simple scrub isn't always enough. You need modern science. And this is where some next-level technology comes into play, fighting the battle not with brute force, but with smart biology. So check this out. Advanced enzyme toothpastes, for example, use this really clever two-step attack. First, they basically create a shield that stops the bad bacteria from even sticking to your teeth. Then they go on offense, weakening the plaque that's already there and kind of disarming its ability to cause inflammation.
And the results? They're pretty remarkable. Studies show that this kind of approach can slash inflammation by 86% in just 1 week. I mean, that's not a tiny improvement. That is a dramatic shift in the health of that entire ecosystem.
So what does this mean in the real world? Well, for patients who have weakened immune systems, say someone going through chemotherapy, this isn't just about comfort. Reducing inflammation in the mouth can be a critical factor in helping them have a faster, healthier recovery. It just goes to show how powerful targeted prevention can be.
Okay, deep breath. It's time to zoom back out. We've seen the huge, broken system, and we've seen a tiny but super effective solution. Now, let's connect those dots. This is the aha moment.
So let's just ask the big question straight up. What on earth does a high-tech toothpaste have to do with that giant, fragile public health iceberg we started with?
Here it is. This is the connection. The old model, the one on the left, it only asks one question. What's the cheapest thing I can buy right now? But the value-based model, on the right, it asks a much, much smarter question. What's the best investment for our long-term health? It focuses on preventing disease because that saves the entire system way more money and trouble down the road.
And that's the whole point. You could invent the most incredible, effective toothpaste in the world. But if that giant health system, that iceberg, is still stuck in the old cheapest price wins model, it will never recognize its value. It'll never buy it. The innovation becomes totally useless because the system itself is the bottleneck.
And this brings us right to the end, where we can finally see the whole iceberg and really understand the real, hidden value of health. At the end of the day, our everyday health, your health, depends on the strength of this connection. It's about linking the world of big, national strategies at the very top with the world of tiny molecular science at the very bottom. When that chain is strong, the whole system works. When it's weak, well, we've seen what happens.
So here's a thought. The next time you brush your teeth, maybe you'll see more than just a tube of toothpaste. Maybe you'll see the very tip of that massive, invisible iceberg, that complex, fragile system that we all depend on. And you'll know that fixing the whole thing really starts with recognizing the true value of even the smallest innovations. Thanks for digging into this with me.